All right, feedback. Does anybody know where the word feedback came from? And here's your hint. Sorry.
No, I just was going to say space program.
It is space program and actually rocket science. So it's that loop of information, right? That the device is sending, the honing device is sending back to keep the rocket on course. And so when you do feedback, you are doing rocket science. How about that? So you're providing information to keep the learner on target. It's information about their performance to the performer, and it is actually based on your judgment, because it's based on your experience, your knowledge, your skill. Here's what you need to know. Bottom line, it must be timely, specific, and descriptive. It's very much like disciplining your children. So if you wait 2 weeks to give them feedback on what they did wrong, right, they can't make the connection, and it's too hard then to make the changes and address it. So you want it to be timely, especially if it needs to be corrective. You do want it to be specific. It's nice to say you did a good job, but what was good about it? So that you can keep doing the good parts. And what could you do better? What should you do differently? And again, descriptive. It must include an action plan if there needs to be change. So if they really need to change something about it, then how are they going to do that? And when are you going to reassess it and come back to it again? Hopefully not 50 times, but once or twice until it's corrected. I would say that it's our greatest fear. Why do you think feedback is our greatest negative? Right, we're worried it's going to be negative, right? We're going to completely destroy this person, right? How many of you had at least one episode of feedback as a learner that was done poorly? At least one. Yeah, probably always, right? And for most of us, we don't want to do that to anybody else, right? Even if you're a surgeon like Dr. Appentakli, you don't want to do that. So I think that's why it's our greatest fear. However, I want to encourage you that it's absolutely necessary if those students are eventually going to become, in practice, independent like all of us. And so they really need that direction. And it's our only way to promote progress for them. It's our only way to identify when there is failure and there needs to be correction, or when they're on course and they just need to keep moving forward. So don't worry about doing it badly. I think you're going to do it. All right, so how do we do this? Any ideas? How do you do it so it doesn't completely destroy them for the rest of their lives?
Emphasize the positive first.
Yes, but be careful that you don't give too many when you're going to give a negative, right? But you're right, you do want to, absolutely, you want to say something positive that sets the course, but you also then want to make sure you don't forget to give the other important stuff.
Do it one-on-one and
Never do it in front of
never in front of anybody.
Right. So positive, right? When it's positive, you can praise them publicly in front of everybody. But you're right. If it's negative, if there needs to be correction, you're right. Then you want to go aside into someplace private. The only exception would be if your perception of the type of feedback you need to give and the learner is that they might actually become angry or resistant, hopefully not physically violent. You may want to, or be very, or they may very much going to deny it. If that's your concern, you may want to have somebody else present as a witness. And so that would be the only exception. And certainly then you want to choose somebody that's going to keep the confidence. Probably one of your partners, or if it's in your office, maybe your office manager, someone who can help to bring that student forward and correct the action. So some techniques that help you do that. So the one we mentioned, the video recorder, where you basically just describe what you saw. You palpated the liver edge gently yet accurately. So positive feedback, they did it well, don't need to change anything. You could do the same even if it was negative. You could say that you palpated gently, but it wasn't accurate, and let me show you why, let me explain why you missed the enlarged liver. Okay. Personal reaction, but tempered. You don't want to come across as being angry, but describing what you feel. I feel frustrated when you are not prepared. And so that can be a very clear way to let the student know that they weren't prepared, and it is something you're concerned about. Predicting the outcomes, describing consequences, especially when they've done something that needs correction. If you begin to palpate the liver edge from the right costal margin, you may miss the inferior aspect of an enlarged liver. So explaining why it's important to change how they do that and why you care about it. is asking the learner to self-assess, again, especially if it's negative. So asking them, so tell me your impression of your interaction with the patient. Tell me what you think went well. Tell me what you think you might want to do differently. In our culture in the United States, keeping eye contact, because it is our way that we determine whether people are paying attention. And it's really important when the feedback is negative, even though it's really hard to do, because you don't, right? None of us like to do that when we have to do something negative. Look at it as sharing information. And that will be something that I think you very quickly build rapport with the students that you have here, that, you know, I really want to share information with you because I care about your progress as a student and a learner. Focus on what's observed. So what you have observed or others, again, going back to that, objectives are observable behaviors. So it's not hearsay, it's what's actually been observed. And as you said, positives and negatives, but also limiting the amount, especially if it's negative, that more than one or two. And just think about yourself. When you need to correct something, you know you need to correct it, how many things can you really work on at the same time and be successful? You can try to work on 50, but you're probably not going to be successful at any of them. But if you're focusing on one or two, you'll be successful. And then always summarize the bottom line of the information. So give them a summary of, here are my concerns, and here's the things we're going to work on. And making sure there's the action plan and the follow-up, and that there's shared responsibility. You don't have to come up with all of the action plan. So if it's that the student is having difficulty focusing appropriately in a history, then you can ask the student, okay, what do you need to do differently? And how would you like to approach this so you can learn this skill? And they don't have to answer it right now, they can have some time to think about it. Making sure it does get followed up, that it's re-observed, it's followed up in some way, gets reassessed, and if necessary, the action plan is revised. But I think if you have to revise an action plan more than once, you should be talking to the clerkship director, because that's someone that isn't responding to the efforts that you're making. Good for a couple of things. All right. So during the patient interview, so I'm saying this to the student and learner, during the patient interview, you occasionally use statements as questions. You do not have any pain. What sort of feedback would you give to the learner? What sort of action plan would you have for them?
Work on using open-ended questions.
Okay, yeah, open-ended questions, you could give them an example, right? That really what you want to say is, do you have any pain? You could even talk about consequences, that if you do this, you lead the patient and you may not get accurate information, and then you're not going to have an accurate diagnosis, you're not going to have an accurate treatment. Good. So using open-ended questions, actually listening to yourself, which I realize is a bit hard to do, but really thinking and listening to how you ask questions, and then you'll want to re-observe it. Whether it's the end of the day or the end of the week, this is something they should start to correct pretty quickly, although it may take several weeks of practice to be consistent at it. So what sort of feedback techniques were used there? From the standpoint of that video recorder, emotions, expressing your emotions, talking about consequences.
Video recorder, and you told them.
Yeah, you're describing what you saw. You could interject some consequences into it. How about this one? I feel angry and embarrassed when one of my patients is dissatisfied after you evaluate them. So what direction would you give the student? What would be the action plan? Or maybe you need more information. Would anybody want more information?
Yeah. What's going on in that room?
Yeah, exactly. What happened in that room? Yeah, the patient wasn't happy. What happened? So, starting with the student, tell me your impression of what happened. Talk to the patient to find out their perspective. Was there anybody else? Was there family or staff that witnessed what went on? So really gathering all the data and the information. And then developing a specific plan so that the interaction for both the patient and the student can be more satisfying and worthwhile. So what techniques was part of that? Video recorder, expressing emotions, talking about consequences. Yeah, I think so. So definitely, I expressed my emotions about it. Hopefully I did it in a way that wasn't overly emotional. And I do agree that this is one where you want to talk about consequences. So when patients aren't satisfied, what happens? Now, I'm sure we've all had one or two patients that, believe it or not, didn't like us for some reason. Something just didn't quite go right? So it does happen. So what do? How do you handle that? Because it will happen. So it can be a really important learning experience of then what do you do when something doesn't go right, when a patient's upset? How do you manage that situation? All right, one more. Lack of undermining after excision of a skin lesion can lead to a number of complications. And you can actually list all those complications. So you saw the student do the procedure, you thought they knew how to do it, but they didn't undermine when they excised a skin lesion, they didn't undermine when they were closing this, before they closed the skin. So what feedback or direction would you give them?
Have them watch another one when you do and
Right.
tell them, watch them do it after them.
Perfect, yes. You do the next one, and as you're doing it, you really describe and demonstrate the process for how you actually undermine. So you use the tips of your iris scissors to blunt and sharp dissect the skin from the subcutaneous tissues. It mobilizes the skin layers to permit accurate epoxidation of the wound edges. So what techniques did this one use? Is there any emotion? Consequences, yeah. So it was very much about consequences. So at the mid-clerkship, midway through is when you definitely want to sit down and have that face-to-face discussion of how are you doing at this point in time in relationship to the objectives that you officially have from the school and the clerkship, as well as other objectives that you've set together. And it's a time to look at those and make just changes and revisions. They usually have some variation of assignments or projects, so finding out where are they with that, is there anything they need you to help with for that to be successful? How's their schedule going? And again, having them keep track of who they're seeing and what they're seeing, so looking at that together, again, is it on track to help them meet objectives? Do they have any specific concerns or requests? How's their involvement with others, with the staff, with the nursing staff, with other people in your office, with other people in your group? With colleagues, because you probably interface with other specialists besides your own group. And can they give you some feedback about how you're doing? How are you doing at facilitating? How are you doing at giving feedback and teaching? Is it helpful? Is it useful? And again, just talking about some of those professional things is another opportunity to do that. So this is one of those times where you really do want to schedule a sit down together. You can do it over lunch. You can do it over something like that to try to minimize the extra time part of it. Food always helps. Any question about feedback? All right, is anybody willing to offer a definition of evaluation? Take a step back. Do you fill out a form? Usually, whether it's electronic or paper. Okay. Do you put any information on that form? Or you just sign the bottom of it?
Number, then you put the
Give
number.
it to my secretary and sign it.
And let her decide. That is one way to do it. It's probably not the best, but it is one way to do it. So you're right. You're filling out something, right? You're grading, you're ranking, you're rating. So it's a process of making judgments based on factual information and observations, which you will have several weeks of them, hopefully. And you are going to rate, rank, grade. Now, you may not put an ABCD on it, but your evaluation will turn into their grade. And it's another reason to talk about it up front, that it's really up to them what their grade is, right? They know what the evaluation form looks like. If they don't, they need to go look at it. They know what the objectives are. You're meeting with them, you're talking with them. So what they get at the end is pretty much just documenting the end result. So the bottom line on evaluation, here's what you need to know. It drives learning. The good and the bad news is whatever we evaluate is where learners will focus. So we have to be careful what we evaluate, because all of us care about what's the grade at the end, just the way it is. So objectives determine the evaluation, and again, it's why the objectives are so important, because they will determine what you're evaluating, how you evaluate, and again, what you decide you're going to evaluate will be where the students spend their time and energy. I would say it's our second greatest fear after feedback. Feedback's our first greatest. Evaluation is our second greatest fear. And I think for the same reason, right? How many of you had at least one bad evaluation? You don't have to put your hand up. Or at least one that you didn't think was as good as it should be, right? At least once. That happens somewhere along the way. I bet almost all of us. And again, we don't want to do that to somebody else. But we do need to be honest and accurate about what's going on, or we prevent them from becoming all that they are capable of being. And it is necessary. It's the way we determine whether learners, students, and residents are progressing towards independent practice. And it's a process that we all keep going on for the rest of our. So why do we make you fill out that form and do that formal evaluation? What happens to it? I mean, you're probably wondering what happens to it, right?
It goes into the grid.
It does. So it goes to the clerkship director, who then takes that along with, they will have, for the third year, they will have exams at the end of every specialty rotation. And pretty much we use the shelf exam, which is questions taken from part 2 of boards, step 2 of boards. And so they will also have that as part of it. And then any other projects they were required to do will be weighed into that as well. But for most of the clerkships, the clinical evaluation carries the most weight. So it summarizes the performance, it does determine their grade, and most importantly, determines their competency, their behaviors. How well are they performing? Are they performing at a level that is considered competent for where they are in their education process? It should also be a guide for future learning. So the areas they're doing well in, identifying those, as well as the areas where they need to make improvements. And again, it's part of that determining ability and progress to independence. So how do we get there? How do we get to evaluation at the end? It's all the things you just did.
I just set objectives up front
Yeah.
and make sure that they're met.
Exactly. It's the objectives and whether they're met, and you're going to know that by observation and feedback. So those really are your key pieces to not just the learning process, but the evaluation. So some strategies to help. Actually look at that stuff we send you. I think the clerkship directors at Chicago Medical School have done a good job of really trying to get it down to the core information that you need to have. If you have a question, get in touch. Call or email the clerkship director. If you can't find them, get in touch with myself or Dr. Abentak, who will find them. We actually have a great relationship with that. And think ahead of time about how are you going to be able to do the observing that you need to do to determine if they're meeting the objectives. Look at the form on the first day with the student. In fact, I suggest making a couple copies of the form and having the student evaluate themselves. So at that midpoint, have them come in with an evaluation form they did on themselves and self-evaluate. It gives you a really good starting point for the feedback. Collect data along the way. Keep some notes. Have the students self-obsess. Sorry about that. And then the form. We're probably already obsessing too. I suggest completing the form about 2 days before the last day, because you'll have enough information. And it gives you time to sit down, do it unrushed, and plan to meet with the student, so that you actually sit down and go over the form with them. We ask you to do that. I know it can be difficult if it's negative, but it's really important for them to actually hear it from you and have a chance to think about it and have a chance to ask you questions if they have questions about the evaluation.
Do you know when you're going to meet with the clerkship directors and when to expect this materials?
I don't. So, but we tried to, they weren't available this evening, neither one were available. So Dr. Kicken for internal medicine and Dr. Mesky for pediatrics were not available tonight. But so what I think they're going to do is make a separate trip out to do that, but we will follow up on that and let Dr. Waxler know so he can communicate that back to everybody. Because we would advise, because they want to do that. So one, they want to meet with you, they want to talk about the details. If students are coming in January, then my thought would be they'll probably come in November or December. If you want it sooner than that, they can certainly send it ahead of time, and so we could suggest that they send it to you ahead of time, and then schedule a time a month or so before the students to actually go over things and answer your
And
questions.
not to digress too much, but.
That's okay, go ahead.
You know, the other thing also is some of the teaching for the staff on what to expect from medical students, because, you know, like to guide us or how to do we can get the staff together, or at least keep people from the staff to tell them what to expect and how to handle, deal with medical
Actually, that's a
students.
really good idea.
Yeah.
And usually, if they're going to be in an office setting, I do recommend that you do that at least with your office staff. I realize if they're going to be in the hospital setting, that's harder for you to do by yourself, but we can certainly give that feedback, maybe to Dr. Waxler, and ask him how he wants to proceed with that, because you're right, they need to know what to expect.
And the other thing is the patients in the office, because I can see that they can spend half the day in the office between first talking to the student, waiting for the student to present to me, and then me going back and talking. I mean, that's going to be a 3-hour affair, right there. So how do you select the patient who will actually do that? How do you warn them up front, you know?
You know, in the office, I've done this before, and what I used to do is, because you know your patients, so if I know that this will be a good patient for the student, I'll have I actually used to have my nurse already ask each patient if it's okay for the student to come in. Some will not like it at all, so you can cancel those out. But the rest, you kind of pick out which ones that you think might be useful, because they don't have to see every patient. And then we used to upfront ask the patient, do you have time to wait and go see 2 other patients while they're kind of completing. So it saves you time. Some patients are okay with that.
Because anymore,
And
we're being
like elderly
evaluated
patients
by how
sometimes-
timely we are.
Yeah, elderly
Yeah,
patients
so-
sometimes actually like the attention. They love it. You know?
Exactly, yes.
So,
So you did, that
that's
was
what I used
perfect.
to
That's
do.
exactly what to do. And I think if you have concerns about how the practice is evaluating, then a practice needs to talk about that and come up with an approach. So they can't, if you are agreeing to teach students and you all have decided that's important, then they can't ding you, they can't give you negative marks because you took extra time. So how does that get weighted into the process? But yeah, it is about selecting the patients. And so yes, your nurse or your staff can ask them up front. You could even put an announcement in your office, so where the kind of, someplace where the patients will see it and it's a really nice way to let them know you're involved in teaching and you're connected to a university. And then it's kind of an announcement to the student that you're going to have student, Ashley Jones here for these days. And so that's a good way to announce it. And your nurse can either ask them when they come or call them ahead. So depending how far out you schedule your patients in your office, you can identify them ahead of time and actually say, would you have the time to be here for 2 hours instead of 20 minutes?